Unbelievable. Joining us now to help sort this out, the CEO of Augusta Health, Mary Mannix. Mary, thanks for being with us.
Good morning.
Now, Mary, tell our audience very quickly, Augusta Health, one of the last really private, no public funded single hospitals in Virginia, right?
That's correct. We're one of approximately 5 freestanding independent hospitals that remain in Virginia.
The provider tax that the Maxter has put forth, as I said, he was on my show yesterday. We questioned him on it. And basically he was saying is, look, it's not really a tax. It's just shifting cost and revenue from one hospital to the other. It's moving money around so that it's a fairer system for everybody. Is that true?
I wouldn't concur with that. It is a program that's based on the federal matching money that comes to each state in the administration of the Medicaid program. And it's based on the framework that every state has a matching ratio, if you will, and it varies from state to state. In Virginia, for every dollar that the state government puts into the Medicaid fund, then the federal government matches $1. And so basically the framework is by taxing hospitals up to 6% of their total operating revenue, that money can be put into the state fund for Medicaid patients and then could be eligible to be increased by $1 match for every dollar that's put into the fund. And then theoretically, it would be available to reimburse hospitals or providers for care of their Medicaid patients. There is a couple caveats to it.
Right.
Number one, there's a cap in terms of how much money could actually be matched to be able to take care of Medicaid patients, indigent patients. The program must be approved by the Center for Medicare and Medicaid Services, so it has to be approved by the federal government. There are probably 40 different plans throughout the United States. If you've seen one, you've seen one. They vary. And the monies have to be redistributive, which means when the monies come back to providers, hospitals like the 78-plus hospitals in Virginia, there's no guarantee or hold harmless clause that the tax that you pay out, you will get back in terms of enhanced Medicaid reimbursement for your care of Medicaid and indigent patients. So it's a high-risk proposition during a time of great vulnerability for hospitals in the Commonwealth of Virginia.
I look at this tax, Mary Mannix, and it looks like kind of a dishonest shell game, if you will. It really smacks like it's defrauding taxpayers by exploiting a loophole to get the supposedly free federal funds. And whenever I see free federal funds, I immediately become suspect because here's the reality so our audience understands it. Because of the varying disproportionate reimbursement schedule, some hospitals in non-congested areas, rural areas, right, they're not going to recover the full amount of the 6% tax because they don't have the people there. Now, the big hospitals are going to get potentially, the way I look at this, they're going to get overcompensated. So it's like bigger gets more, not bigger gets screwed, and the hospitals struggling in the rural areas where the people down there don't have a lot of choices, or in those areas, those hospitals could actually go under as a result of this. How does this make any sense?
Well, for example, Augusta Health is a rural hospital, as you noted, and we serve a rural area, and we're the sole community provider in this area. And we're very concerned because we have to have a positive operating margin in order to be able to fund our mission, in order to be able to provide key safety net services to the community. Our concern is that we don't have a large system to fall back on to be our safety net. We are our own safety net, if you will. So our concern is that if we get taxed a new tax up to 6% of our total operating revenue, that could devastate us financially in terms of our ability to fund our mission. And because we don't belong to a large system, we're not part of a large conglomerate, it makes us particularly vulnerable. And there's no guarantee that the tax that we pay into this program will not be greater than anything we would get through theoretical enhanced reimbursement. And so we think it poses great risk. And there is the potential that some of those hospitals, and there are many variables. It's not really just the size that determines what each hospital would get back in terms of Medicaid reimbursement, their base rates for Medicaid reimbursement. It's based on complex formulas. It's based on their payer mix. It's based on very different variables, but it's a high-risk proposition, especially for those of us who remain independent, are not part of larger systems, and could be the type of thing that would force us to change our entire model of community-based care.
This provider tax, if it were to become law, is really going to create classes of winning and losing hospitals in Virginia. Those that listen to my show regularly know that I am opposed to anything where the government is involved through tax policy picking winners and losers in a free economy. I think that's a prescription for disaster. Now, what are hospitals like your own telling the General Assembly members about this, what I see as a very harmful proposal?
Well, we have gone to all of our legislators and talked about the great concerns with what's being proposed. And just last Wednesday evening, when our board of 15 community members met, we spent over an hour talking about the magnitude of this issue and the potential impact, devastating impact it could have on Augusta Health. So we have met with our legislators. I had the privilege of meeting with the governor last month to talk to him on behalf of the Virginia Hospital Association about our great concerns. We think that this is something that would need to be studied very, very carefully, and all of the intricacies would need to be understood. These are very complex programs. As you mentioned, there are a lot of variables, a lot of complexities, a lot of loopholes. There are variations of these programs. In fact, I would mention to you that CHS, which is a for-profit hospital based out of Nashville, Tennessee, just had a settlement with the federal government on the administration on the variation of one of these provider tax programs. It was actually called an intergovernmental transfer program,
right,
which does sound like a lot of shifting of monies. And they just announced on Monday of this week a settlement agreement with the federal government for $70 million based on the inappropriate administration of one of these types of programs. So we think that it is something that needs to be studied very carefully. It's not something that you would move very quickly on. There are a tremendous number of implications, and they have to be in compliance with rules of the Centers for Medicare Services. So we think that just to slide in a very nebulous budget amendment is not a responsible act, and therefore we're advocating that this be studied very, very carefully before we would want to move forward with any type of such program. We have great concerns about it.
Well, Mary, you're very gracious in asking for a study. I don't have to have a study. I just think it should be scrapped because this is a disaster as far as I'm concerned. Listen, I just got a text from Mike in Virginia Beach. He says, this sounds like just another shell game. You might as well go to Las Vegas and play the craps table. That's from Mike, one of our listeners in Virginia Beach. Look, by the way, we're with Mary Mannix. She's the CEO of Augusta Health Commons. Mary, the bottom line with this thing is that although every hospital is going to pay the tax, there's only a handful that are going to get the money back, right? And the ones that get the money back, once again, are the big hospitals like Centera with the big lobbyists, with the big dollars they spend, right? But little hospitals or hospitals in rural areas are going to get screwed because you're going to pay the 6%, but you're not going to reap any of the benefits, right?
Well, that is our concern. There are certainly no guarantees with these types of programs, and as you mentioned, there are winners and losers. And I can tell you the concern on behalf of Augusta Health, and I'm sure the very few remaining independent hospitals in Virginia are that we will not end up being winners, and that these will be devastating economic models for us, and the type of thing that could cause a collapse of the type of model we provide of community-based medicine. Where we have people from the community sitting on our boards, our board and the governing bodies for these community-based hospitals. We don't have people coming from the Tidewater area or from Nashville, Tennessee, or from Charlotte, North Carolina to make decisions about our community health. They're made by people who live in the community and who also are recipients of the health care in the community. And we feel that this poses a great threat to that model of community medicine, and that it will just force several of these smaller independent hospitals to have to join larger systems when that may not be the preferred model or the right model for those communities.
Mary, this $1 billion tax figure, $1 billion is a lot of money, okay? Even in Virginia. It's a lot of money. It's kind of eye-popping. And this provider tax scheme, well, this wasn't just created out of thin air one day, right? I mean, hasn't this precise thing been tried before in Virginia and been rejected?
Yes. Now, I came to Virginia in 2008, but I've done research, and I understand this was proposed in 1988 by then Governor Baliles, and again in 1992 by then Governor Wilder.
Right.
And these programs were rejected. There are some real horror stories about what the outcomes of some of these programs have been in other states. And, the Virginia Hospital Association has traditionally been very opposed to imposing those types of risks in the Virginia healthcare system. So, yes, those schemes have been rejected and got no traction, again, the two times that I'm aware of, 1988 and 1992.
And in both times, a democratically controlled General Assembly rejected these as nothing more than what it is, which is an income transfer and a Ponzi scheme. That's all this is. And so, as the head honcho of the Hospital Association, you can't say that, Mary, but I can. And that's what it is. This is a Ponzi scheme, and it has to be stopped. Now, let me just say as an aside, Mary, not necessarily affecting this at all, but I get 10 emails a day from Susan Stimson, who's running against Speaker Bill Howell in Stafford, in that district, raising Cain about taxes. I would like to see Susan Stimson do an email on this instead of whatever she sends out on transportation or something else, because this is a $1 billion Ponzi tax scheme that doesn't make any sense at all. It's already been rejected 2 times. How do you stop it? Mary, how do you stop it?
Are you asking me?
Yes.
I think that it's really important for constituents in every community to speak with their legislators about this and the grave concern that they have, and the risk that this poses at a very vulnerable time for hospitals. Hospitals are having all of their reimbursement reduced across the board from Medicare. We're not participating in the Medicaid expansion. Commercial payers are also following suit. We're at much greater risk in terms of the reimbursement. And then to introduce a model like this at up to 6% of our total operating revenue on top of everything else that hospitals, the health providers are going through across the nation, to me is just ludicrous. It's just, I almost feel as though there is this, if I was paranoid, I would feel like there was this vendetta against trying to bring down all hospitals across Virginia.
There's an element of political leadership that is more comfortable with bigger hospitals, public-funded hospitals, and those that are acting and operating independently, like yourself. Everybody's trying to bring them in line, whatever line is. But this thing is nothing but a Ponzi scheme. It's a backdoor way to get Medicaid expansion in Virginia back on the table, which has already been rejected soundly. And I tell you what this reminds me of. 1972, George McGovern running for president. He proposed that everybody would get $1,000 tax back, like a refund check. Everybody would get $1,000. And then those making over $65,000, I believe, would then get a higher tax, so that would all get paid back. He won one state, right? Because people saw through the scheme. They're not interested in the government collecting money and then deciding who to reallocate it back to. I would encourage anybody listening today, call your General Assembly member, call your House member, and say that you are opposed to the $1 billion Ponzi scheme provider tax. Mary, we really want to thank you for being with us today. I know that you're in a tough situation, and keep fighting the good fight, because somebody has to get on the air and say this thing is just a disaster. Thank you, Mary.
Thank you.